Very, oh yeah, that's Kathy. Well done. Introducing myself and the people who are with us. So I am Misty Coy Snyder, and I am the creator of Happiness is Down Syndrome. I'm the creative director of Rod's Heroes, and I love working with Team Iron Will, Kathy from Team Iron Will, who we'll talk in a moment, and also with Caring Tide. So Carly and Kathy are with us, in addition to our fabulous guests who you'll meet in a moment. Before I pass it off to Kathy, I just want to mention that please put your questions in the comments throughout the webinar so we can kind of keep track of those. And if we have time, we will have time for questions. And after this webinar, you will get access to a recording to rewatch it if you have questions or whatever, or you might be watching this later if you're not here live. Always reach out to me through Rod's Heroes or Happiness is Down Syndrome if you have any questions. And we are just so thankful and glad you are here. Kathy, I want to pass it to you.
Hi everyone, I'm Kathy from Team Iron Will, and if you don't know, our organization provides resources, mostly therapy equipment, access to therapy programs for families in the Down syndrome community. And Misty and I have been hosting these for a while with Team Iron Will and Happiness, and now we're excited to do this one with Rod's Heroes and Caring Tide. And I'd just like to welcome you all here, and I'll pass it on to Carly.
Hi, everyone. I'm so glad y'all are here. I'm with Caring Tide, and we're a disability planning, like full service to provide resources and planning for financial, education, IEPs, benefits, just the whole complexities of the system. And we're super excited to help host tonight, and we love partnering with everyone here. I'm personally a nurse practitioner, so I love it when medical providers step up and kind of show a vested interest in our community. It's really special to me as a mom with two with Down syndrome. And I'm just really appreciative of the dentists here tonight who are sharing their expertise and supporting us. We are going to be sending out, like Misty said, the recorded link. It will be coming from a Caring Tide host. So make sure you're looking for that as that comes to your way. It's also going to include a free consultation with our disability services as being registered with us tonight. So be on the lookout for that. And then we love partnering with Kathy and Misty and all sorts of people in the disability planning world. So if you go to caringtide.com, we do list the events of webinars that we help host just to provide resources for our community. And so that's it for me. I'm going to slide back to Misty.
Yes, hello. That was the fastest and coolest we've ever done it. Way to go, girls. So again, I'm Misty, and it's so neat that we're here tonight because I met Michael Lee, if you could wave. I met him in Texas at NDSC this past summer, and we've been in close connection ever since, trying to make this happen, and so excited to do future collaborations and just kind of get this going. So, Michael, I would love if you would just introduce yourself too, and the doctor.
Great. No, I am Michael Lee, the Executive Director of the PDS Health Foundation. One of our strategic pillars is disability healthcare, oral and overall health. Not only having a place in Phoenix where we see about 5,500 patient visits a year, but also education and partnerships nationwide to bring advocacy because we have a general saying that 75% of all patients can be seen in a regular dental setting. If we partner up with the caregivers, plan, but also educate nationwide on how important the oral health and overall health is connected. So I'm very honored to have Dr. Dian, one of our providers here, but also she serves at as a president of the AADMD, which is an amazing organization that educates and brings together the community gathering for all types of healthcare, for medical and dental. So I will leave it to Dr. Dian to introduce herself, but also lead the session because believe me, everyone on this call, you will love to listen to her. Bye.
Oh. Thank you very much. Thank you, Michael, and thank you to all of you. You know, I just came off one of our AADMD board meetings, and I'm going to enjoy this one so much more. So just like I said in my previous video, I think we sent it out to you. I'm so looking forward to meet you all. And, I hope I get to meet you in person someday. I am a pediatric dentist. So as you know, dentistry is a 4-year, I would say, health provider course, right? You are in dental school for 4 years. And then you can specialize. And for me, I specialized in pediatric dentistry, and that allowed me to train to care for those with intellectual and developmental disabilities. And everybody asked me, Dian, why did you want to work with children and adults with special needs? And my answer, I really don't have an answer. For me, it's just the next person, my next best friend, the next patient, right? So I was fortunate to choose pediatric dentistry because it did allow me to become board certified and to be able to say, I care for those with disabilities. I am here to say, I care for everyone, and those with abilities, as in I see the ability before I see the disability. So that's just my disclaimer there. Now, I know you're hearing an accent. I am from Trinidad and Tobago, originally in the Caribbean. I left the island to go to boarding school when I was a teenager. I was very, very blessed and fortunate. So, to whom much is given, much is expected, which is why I'm right here, right now. After that, I returned to Trinidad and became a school dental nurse. I wish we had schools with dental nurses still here in the US, where I would go to a school, gather up a group of children, take them up to the clinic. It was usually at a community healthcare center, and provide care for those children. And that would be preventive care. So yes, your brushing and flossing and your hygiene appointment that we'll talk about, but also operative, the simple fillings. And I had no laughing gas, no anything. I think that's what made me exercise behavior control, I hate to use the word control, behavior acceptance, and being able to adjust to it, right? Because I had nothing but myself to give to the children to make them feel comfortable, and to give to the parents as well too. So after being a dental nurse, the dentist that supervised my work, behavior acceptance, thank you, Carly. The dentist that supervised my work thought I was wasting my time. You need to be a dentist. If you could be a dentist with that mindset, you could reach out to those adults and children with anxiety, those that are afraid of going to the dentist, and make them feel comfortable so that they can have comfort of care while they're in the dental chair. My mouth always gets dry when I get so excited. I'm so excited. Hold on. So I then went to Howard University for my undergraduate degree, and then to the University at Buffalo for dentistry. And that's where I stayed and specialized first in hospital dentistry and then in pediatric dentistry. This allows me to not just see children with intellectual and developmental disabilities and special needs, but also adults. While I was in dental school, I had my son, Jamal. Both of my children actually were born, just one before dental school and one in dental school. So if you know anybody interested in dentistry, if I can do it, they can do it. But Jamal went on to become a dentist and an adult dentist. And I absolutely love that because, again, if there's any work that I cannot complete, any treatment, any service that I cannot do, I know I can hand that right over to Jamal. But I really try to be able to do it all. So I'm going to share a PowerPoint that I have. Excuse me as I show all of this stuff here that I have all over. Oh boy, hold on a second. Let's see if I can get to my slides. This is a PowerPoint that I put together for one of the Head Start schools, but I thought it really could apply here. And I'm just going to pull it up in a second. I'll keep talking until then. You're probably wondering, how did I get to where I am right now? Well, I was based in Buffalo, New York. And if anybody's from the East Coast, do we have anybody from the East Coast? Yeah, you would know the weather there is not always the most fun. I was looking for warm weather, and so were my two children. They decided to go to college at NAU, and that would be in Flagstaff. And that was my introduction to Arizona. And at that time, I wanted to work on the Native American reservations and as well find an office that was providing the quality of care that I believed in. And that was Pacific Dental Services, now Pacific Dental Services, Pacific Dental Health. And the foundation that I work for allows me to work in a clinic for children with special needs and adults with special needs twice a week, sorry. So on Thursdays and Fridays, I am in Phoenix caring for those with disabilities. And then for the rest of the week, I am in Tucson opening an office with my son where we care for all abilities. I am the past program director for pediatric dentistry in Buffalo, New York. So I was doing very well in Buffalo and really having the ability to teach, which is so very important for me. I can do all the talking that I'm going to do here for you today and talk about going to the dentist and what will make it easier for your children. And I can talk about dentistry and how important it is. But the most important message that I need to get out is that we need to make sure that we are teaching our dental students and our medical students so that they can carry on the cause, because your children will grow up and I will grow older, and we need to make sure that dentistry that is from your heart is being practiced. So I'm going to try one more time to see if I can share my slides. Everybody doing okay?
Yeah.
Excellent. Excellent. Okay. So this at least will give some imagery as I'm chatting about going to the dentist and why that is important and how I can make that more comfortable for your children. Here's a picture of me to the extreme left with my brother. He now lives in England and I'm here in the US. And here's a picture of me dressed up as Doc McStuffins for Halloween. And I'll use this picture to say the one thing Michael left out in his introduction about what we do at Pacific Dental Services, Pacific Dental Health, and the foundation, and those of us who care for those with special needs, is you have to have fun. If you're not having fun, your patients are going to sense that. And I know you know that about your children. You know, as you approach that dental office or anything that's not really portrayed as fun, the tension and the anxiety, right? It breaks my heart. And so fun is the essential core of everything that we do. And with fun comes that natural love for whoever is in front of you, right? I meet a stranger pretty much every 20 to 25 minutes. And when they're all set with their appointment, it's my new best friend. That's what I'm looking for. I just got to make sure that my new best friend has a healthy smile. So the image to the right is my son Jamal. And yes, you know how we love to talk about our children. So same thing with me, as well as dental students. And this is at our Pacific Dental Services Health Foundation dental clinic for those with special needs. We have dental students that are rotating through there now for 2 weeks so that they can experience what it's like to care for just what I think is the most loving population. All right. And I really, again, love being a dentist, but more than that, I love sharing my profession and make sure that others can love being a dentist and can provide the love that's needed. So let's talk about why is it so important? I mean, the teeth, as we know, right, it forms the shape of the face. It allows for that smile, right? It keeps us healthy. It's what your children use for eating, for speaking, for expressing themselves. It's so vital. Everything is about that smile, right? And this is a case actually where there were cavities and fillings had to be done on the forefront teeth that you see there, D, E, F, and G. You can see the gum tissue looks nice and pink and healthy, maybe just a little bit swollen and irritated around the crowns, right? If this was their natural teeth, maybe it would have been healthier. Once you have to do a filling, you're putting your child at risk of food trapping, the filling breaking. So I'm here to talk about how we can prevent you from having to go to the dentist for those fillings and extractions and gum treatment and so on and so forth. And of course, the basics is the brushing and flossing. And it's not that easy for anyone, not just kids with intellectual and developmental disabilities. Our kids who are neurotypical, it's anxiety, right? Some of us don't like anything near our mouth or something that tastes too minty, or a string that's going across your teeth and then being snapped up and down. So we have to find ways to brush and floss and have tips and tools. And it was around Halloween time, I think, when we brought up the name of this presentation, tricks that we can give you to help you that you can brush your child's teeth. I will tell you there's so many different types of toothbrushes. If anybody has been introduced to the one that's 360 degrees, you can certainly put it in chat. But there is that toothbrush that wraps around the tooth. So it allows you, as you place the toothbrush in the mouth, you're brushing the front and the back at the same time. So if you're only getting about a split second in there, at least you know you're capturing the front and back of the teeth. But I'm thinking your kids are okay brushing. And if they're not, certainly put questions in chat. With toothpaste, there's so many different types of toothpaste as well. The different flavors. There's always a question about fluoride or not fluoride. As a pediatric dentist, I am one who follows the guidelines. I was program director, so I teach those guidelines, but I am very understanding to those patients and those parents that come to me and say that they are uncomfortable with fluoride. Let's talk and let's find alternatives, because what I do see are more cavities, and I need to make sure that I'm doing the best I can to help you keep those teeth cavity free. Mouthwash can be a little bit tricky, right? To get a child to be able to spit that out, to find a flavor that they like, and then to be concerned if they're swallowing it, if it is a flavor that they like. You may be familiar with the Act fluoride rinses, the bubblegum flavor, and yes, it helps to prevent cavities, and I do like it. But if you have a child that's swallowing that bubblegum fluoride rinse, maybe dip the toothbrush in and have them brush the rinse on with their toothbrush instead. And definitely if you're seeing white spot lesions, I don't know if you can see where my arrow is pointing here, but that would be what a white spot lesion is. If the tooth is dry and you see an area that shines a very bright white, that can certainly mean that a cavity is starting to form. It means that the enamel is starting to break down. Flossing, I have the words floss in here. Flossing is important. Do the best that you can. Drinking water will work as well too, and really make sure that they're gargling and spitting out. But you know, I advocate for the flossing, but I understand that can be a challenge at times. Brushing techniques are taught in dental school. We have the Bass technique as the most common, where the toothbrush is held at 45 degrees and then you circulate. If it's a top tooth, you brush down. If it's the bottom tooth, you brush up. Now, I can't go into schools and classrooms and teach that and have kids remember that to go home. And so for you as well, for your kids, brushing round and round in circles will mean that you're automatically doing that up and down motion, as well as that 45-degree angle against the gums. The whole idea is that you're not just brushing your teeth, you're trying your best to get those bristles onto the gum tissue, okay? Now, this is a lot of toothpaste. We advocate for a very small amount of toothpaste, and depending on the age of the child, it might be a rice size for the very young babies, a pea size as they get older. A full ribbon, you would only probably be prescribed that if you have a teenager that has a lot of decay, and we need them to use our fluoride toothpaste, our Prevident 5000 or Clinpro 5000, a toothpaste with a higher concentration of fluoride. At that point, for that teenager or young adult, we will be saying brush with a ribbon full and then expectorate, spit, but don't rinse. With our little kids, we still advocate for brushing with a pea size. I would say would probably be the average as I look at the ages that are there. And we still advocate for rinsing and spitting, okay? All right, here's our little angle of brushing. Toothpaste, again, we talked about that. A very little bit of toothpaste, as you see on the left. You really don't need too much. And what I tell the little kids, and again, I prepared this for little children, so I apologize, is toothpaste is good for your teeth, but it's not good for your tummy. So don't swallow that toothpaste, all right? For the little kids, singing a song, right? Again, I talked about dentistry being a joy. So I can't tell you, all the kids I saw today, everybody came in with a different song, and they certainly didn't want to hear mine. But for me, it's about singing the ABC, for instance, A, B, C, D, E, F, G. And instead of ending with next time, won't you sing with me? I usually will end with next time, won't you brush your teeth? And you should see the look of the faces that I get. And I know you got some spicy kids out there. They will look at you like, that's not the right song, but it caught their attention. You do want to have that brushing go on for the length of a song, you know? Some will say 3 minutes, 2.5 minutes, do the best that you can. The electric brushes that have a timer or that have a song to it work very well. I have been a traditional toothbrusher for a long time with a traditional brush. I now use a combination of the traditional brush and the spin brushes. And it's because there's a timer on there. If not, I'm such a busy person, I'm rushing out before that timer is done. So I do recommend, if you can afford it, to get the spin brush. If you're in the spin brush, realm, that's what I want to do. Find the one that has a timer or a song to it. Okay. Flossing, very important. Don't forget to do the flossing. Do the best you can again. Most of you are probably using the floss holders that you can gently guide between the teeth instead of the string floss. If you use the string floss, one tip is to keep the end that's in the mouth inside of the behind the teeth very short. And maybe you can pull it through instead of going up and down. Because even us as adults, it's quite difficult to floss as well as you're seeing in this video on the left, right? And for those kids that love the floss dance, I think this is one of the most fun inventions for us, is being able to do the floss dance when you're flossing. As soon as you're done, get that floss dance going on. Keep it joyful, keep it fun. All right, let's see, what do I have here? I think now we're talking about healthy foods. I'm just going to move all right. Do you know why you need your teeth? I think we spoke about that, for eating, for talking, for smiling, and I would add for dignity, right? You know what it's like when you see the children that have to have the silver caps done. I will tell you, those silver caps are the standard of care. And for me, it is a sign of this parent is taking care of this child, took the child to the dentist, made sure to get that silver cap put on because that tooth was failing. The enamel was breaking down. But I have at times parents that will come and tell me they're being teased, or the cavity on the front tooth is causing the child to be bullied and teased. And we certainly don't want that, right? So come to the dentist, we are going to try and find a way to take care of those cavities, to take care of whatever is a problem for that child or that parent, because we absolutely want to make sure that dignity is restored, that they love their smile, that they're proud of themselves, for sure. How are we doing? Shall I keep going? Excellent. I would be remiss if I didn't talk about nutrition. And I know that this can be a tough population. I really want you to do whatever you're doing to keep your child eating and drinking and functioning during the day, right? Sometimes it's tough. The majority of the patients I see, none of this is on their menu. It's chips, Cheetos, Doritos, cereal, chicken nuggets, pizza, and French fries. And I have to understand the priority is, did my child eat something today, more than did I get that vegetable in there? Did I get that yogurt in there? Try your best, try your absolute best. I know that there may be some children that are still drinking milk and taking milk to bed. Those are the things you want to be careful of, or drinking juice and taking juice to bed. Those are the things you want to be careful of. And if the sugary and sticky stuff can be labeled as party food, because it's really hard to say you can't have this. But if it can be, these are things we have at a party, but the things that we eat every day need to be healthier. So be careful with the gummy vitamins, be careful with the fruit roll-ups and even the carbohydrates. I'm sure you know this by now. Even the goldfish and things like that can cause cavities. It's fermentable carbohydrate. It gets broken down into acid, just like the acid in soda pop. And if it's sticky, sweet things, then even worse. It gets stuck right there on the tooth like Velcro, and it's sitting there as your baby goes to bed, and it's becoming acid and leading to that cavity. And kids are tough. They're not going to feel the discomfort of a cavity right away. It's going to take months and maybe even a year before it breaks into the dentin layer. And you know how strong your kids are. They just adapt. Oh, yeah, that tooth was hurting me for a long time, you know? So you want to be there for them. You are their advocate. I tell this to my dental students all the time. Bring the parent in the room. You're interacting with the child, but that parent is the advocate for the child. So make sure to have them involved in all the conversation about the child. So milk is good, sure, but be careful about milk before bed. Make sure to brush that off, and you want to give about an hour before you brush it off. So if milk is part of the last meal dinner, maybe have some water after and then brush before going to bed as much as possible, okay? Avoid the soda pops and the juices and the Gatorades. Keep going for that water and make sure that's the last thing on their teeth at night. Toothbrushing, the toothpaste, rinsed and spit out, and just water if they're thirsty after that, okay? This is another tough one to talk about because thumb sucking can be such a comfort, right? Even myself, I was a tongue thruster, and I know what it did for me was it just gave me that comfort of probably what it's like to be close to my mom, right? And so if this is a comfort for your child, I don't want you to worry too much. Do the best that you can. I'm very fortunate that when the kids come to see us at PDS Health Foundation, they never walk in with a pacifier or thumb sucking. I'm very blessed so far to see no one like that. But then I can look at the bite and I can tell that they're using it to go to bed at night, or they're using it for comfort when there's anxiety. And I don't want to take away from that. What I need to do is say to you, do the best that you can to discourage it before the age of 3. It may not happen. We understand. And we will keep training those orthodontists and folks out there so that they can work on all populations to help with intervention when it's needed, okay? Keep that child as cavity free as possible. Know that when the teeth are protruding, they are at risk for trauma, right? If something, a ball hits them or they fall or hit their teeth, they are at risk for trauma that way. Know that our children that we see tend to have crowded teeth sometimes, and that's another reason for braces. But right now, just keeping those areas where the teeth are crowded as clean as possible. One tooth overlapping the next, try your best to cleanse that area a little bit more than the other areas that you'll see. Look for those trouble spots. If you're not sure about them, bring them in so that we can see them and point them out to you. Sad day when somebody has a cavity, I know, but again, folks have been living with cavities, and there's so many new techniques now to do fillings or to place material on to prevent that cavity from getting worse. Minimally invasive dentistry. If it's to paint fluoride varnish on, if it's to paint the silver diamine fluoride, which we know now those silver ions will actually stop the bacteria, kill the bacteria from progressing and damaging the enamel. If it's to put a simple filling in without drilling, those are some of the techniques that are being developed stronger and stronger now so we can have these interventions without making it too uncomfortable for your child. I don't have to do the video with the filling of the tooth, but I know you know what that process is like. And again, we are just going to try and keep that as simple and as gentle as possible. I will move on. Okay. All right. And you know that you're going to find with your children many different types of teeth. There will be the molars, there will be the canines, and the incisors. For the little ones, the incisors up front, you know they're going to lose the lower incisors first typically. It doesn't have to be that way. and then the upper ones, and then the molar in the back, and then the canine. And those primary teeth or baby teeth are going to be replaced by adult teeth, including what's called a premolar. So this gives me a chance to talk about going to the dentist and some tips that I wanted to use. Of course, before you go visit that dentist, you've probably gone already. Use simple and friendly language as you're talking about it. And I know you're doing that already. The mere fact that you're on this call tells me you guys have this already, right? So into the soft, comfy chair, just a very special, fancy chair. And we're going to give you some sunglasses to put on if it's too bright. And we're going to use just the kindest and simplest words, fun words, so that your child feels comfortable. We want to smile like that. Practice at home. You can be the dentist. And even better, make them the dentist if you don't mind sacrificing yourself as a patient. Let them be the dentist and let them take a look at your teeth and count your teeth. Maybe take a pretending x-ray. I think social stories and short videos are a great idea. And I spoke with Michael earlier today, and we're going to take a look at some of the social stories we have on. I know that PDS does have some cartoon figures going to the dentist that we actually use to teach in the dental school. And we'll be making more. And maybe that's something that could be born out of meeting you all today, that you can help us create those social stories and those short videos about going to the dentist. It may be better to schedule the appointment in the morning when the child is most relaxed as compared to the evening when they're ready to either go to Chuck E. Cheese's or go get pizza or whatever. And avoid surprises. I've had a couple parents that, yeah, we didn't tell them they were going to the dentist, and now, surprise, here they are. And I have to fit into that now and make it just the most wonderful surprise, which always is not as easy as it might sound. So avoid it as a surprise. Important information for our children. You know, we're going to take a very good and in-depth medical history. And I love an office that will give you the opportunity to complete that medical history form before they come in. We're always looking to make sure that if there's a congenital heart defect, if we need to call the pediatrician or the cardiologist and chat. But what we found is the moms and dads really know the medical history and know exactly what we can and cannot do. But do have your primary care pediatrician's numbers available in case we want to call, in case there's anything invasive that we need to do. Let us know about sensory and sensitivities, if it's the light, if it's the sound, even if it's me that's talking too loud. I'm from the Caribbean, so I'm going to be really energetic, but you can tell me and I will tone it down to exactly what your child needs. Because the most important thing is that they have comfort of care, that they're comfortable in the chair so that we can take a look and do the very best. And feel free to tell us their communication style, whether it's hugging, I got lots of hugs, whether it is that they are wanting to talk through you and have you do the talking for them. That is a-okay. Techniques that we're going to use that we have learned, tell, show, do. I'm sure you're quite aware about it. And this is what we teach our young doctors. You tell that patient what you're going to do. I'm going to take a look with this mirror and count your teeth, right? Then you show them, let me show you on your fingers what that is like. And then you can do it. And it's okay to ask their permission. Sometimes the parents will say to me, don't ask for permission, just do it. So I'm looking at you for the cues. Do I go ahead with the do part of the show? Or should I wait? Should it be hand over hand where your child can hold my hand and guide me in there? Visual cues are helpful as well. So to have pictures, I'm so glad I found these slides at the last minute, and I'll have better ones for you the next time. But to have pictures as visual cues so that you can use that as part of your explanation. And really what I try to teach is to have a calm caregiving presence. Again, just like we started, kids can tell when someone is having a rough day, when this is not a friendly environment. They are going to sense that. And so to make sure that the environment that we prepare for you all is one that's calm and caregiving. It says here the mirror looks like a spoon, and that's a nice way to chat with your child about it. We talked about the number of baby teeth. There are 20 baby teeth, if I didn't cover that, and 32 adult teeth. And your children are in between primary teeth and permanent teeth now, probably. So that's called mixed dentition when they're losing those baby teeth and they're coming out. All right, I am going to skip over the video of Little Bum here. I'm from Trinidad and Tobago. I don't know if we have more time for videos also. I think we should stop and answer some questions and I'll look through my notes. But I do have a school in the Caribbean as well too. And these are the children from my school that's there. I get the opportunity to go down and take a look at their teeth. And I told you in the beginning too, who much is given, much is expected. And even though nowadays, sometimes I feel like I don't know where I'm going to get the money from, I tell you, lead from your heart, do dentistry from your heart. You know that that is what is going to make the difference for your patients. When your children come to us, I want them to be able to feel that in us, that we're doing this because we care. So I'll stop here. I'm going to take a look at my notes and see if there's anything else I can give you as tips. Bring comfort items with you. If there's a teddy bear or SpongeBob or Spider-Man, whatsoever, bring that along. You can ask for us to dim the lights or reduce the noise. Tell us if a shorter visit is better. I prefer those shorter visits in the beginning and then let the child give me what they need for the next couple of visits. I know for our children, we are very careful about neck positioning, right? The dentist should be supporting that neck. I just had Michael purchase us a stay-in-place cushion so that dental chair is even softer than what you're used to seeing. And that really helps with that atlantoaxial instability that sometimes we see with our children. We know that they may have hypertonia, where their muscle opening might be affected, and their tongues, they'd be getting in our way. I had one kid today, I think her tongue was playing tic-tac-toe with me. Every time I went here, it went there. And you just find a way to work around that. She was having fun. We were able to brush that tongue, get it out of the way, and get close to the tooth and get that done well. But we're always looking at tongue positioning as we lay our children back in the chair. And there are times we may want to keep them sitting up as well too. And we're always aware of the airway. We're looking at their tonsils. We're assessing, it's called the Malpati score and all of that as we're working. There are wonderful techniques now for suctioning even. There's a little plastic waffle. If I can pattern them to keep the waffle in their mouth, if I need to do a filling, you don't have to worry about water going into the back of their throat. And it's no longer that big rubber dam that you may have had to wear when you went to the dentist or for a root canal or such. And so I'll close here by saying, those are the things I want to avoid though. The root canal, the fillings, the wiggling out of teeth. I want to see your kids for brushing and flossing and to answer questions and to know that you have a dental home if things should go wrong, one that practices compassionate care. All right. Okay,
Love this.
that's right. Patient as a last resort. Okay.
Thank you so much, Doctor. I took pictures of all the questions, so I'm just going to start from the first one. I'm interested in how to manage dental visit for the first time for my child with Down syndrome. He'll turn 5 in February and seems to have a sensory issue because it needs 3 to 5 people to restrain him during blood extractions and haircut. He'll shout and cry, and he's nonverbal. So she learned that kids like this need to be sedated.
Yeah. For me, and I think somebody answered that question, sedation is a last resort. Of course, sedation is right there. It's in our overhead compartment. If we have to go to that, we will. But let's think about it like a plane flight. I mean, I want you to try your best with social stories and maybe even drive the car over to the dental office. Have your little one going, not even for treatment, just to visit, just to run around and come back out. Hopefully you're going to an office that has a sensory room. If they do have a sensory room, we do those visits. Just come on in. There have been patients that I have not been able to get back into the chair. Just like you're saying, they're coming with their occupational therapist, their parent, and let's say grandparent, and they are on the beanbag, on the floor in that sensory room. I will come in with my puppet. I will show toothbrushing. I will try my best to get a look. If your child is young enough that we can do a lap exam where they are in your lap and we lay them back into our lap, restraining with a hug. I need a quick look to make sure that there aren't cavities and that we need to open up. Do we need to open up that overhead compartment and head to sedation? And you probably know that answer from brushing his teeth or her teeth. So if they are in pain, yes, we're going to fill out the paperwork for sedation. But I don't always want to sedate my patient. I don't want, okay, 6 months from now, we're going to sedate again. And 6 months from now, we're going to sedate again. We are going to pattern. We're going to work with the occupational therapist. We're going to, energies also, yeah, if you have a big brother or big sister, you can bring them along so that they can pattern or mirror and see what the hope is and what the future is. You have to have lots of creative ideas in your mind as the dentist. You parents are exhausted trying to figure it out. It's our turn, but I need to see that little one or whoever you're going to. I'm happy to chat with them. So a couple tips, preparation, chat with the dental office and see if you can come by for just a walking and just a care visit. Come take a look, desensitization visit, whatever they might call it. Um, Definitely, if social stories would work, would be a great idea. Talk with the occupational therapist or whatever other therapist you might be working with to see if patterning can be done here. They're 5, I think. So I'm hoping that we could still lay the patient back in for a quick lap exam. And yes, we can fill out the paperwork for sedation, especially if there's a problem. But many times, what we see in there is you're doing the best you can and you're doing a good job. And it may be a new tooth that's coming in that just is crazy for a child. What is going on in the back of my mouth? Mm-hmm. Or a loose tooth, that lower front tooth. We had a child just last week that was just so miserable until, and this is a nonverbal child, and until I said, oh, it's a loose tooth. And you know how brilliant these kids are. He got it. Oh, is that what it is? Is what his body language said, because then he was fine. He was ready to go. So yeah, I hope that helps.
Yes. Several people asked about the grinding of the teeth and any suggestions you might have.
Sure. Bruxism. This is a tough one. Again, up until I started working with occupational therapists, we were always taught in dental school, tell the parents to put their bedroom further away from the child so that they don't have to hear them. How insensitive can we be? And that is the type of stuff we teach in dental school, In talking with occupational therapists, we got to find the cause. What is causing the bruxism, right? Is it anxiety? Is it discomfort? Is it soothing for that patient? What we know, according to our guidelines, is it's absolutely normal. I'm so sorry to tell you that. And I'm not just talking about children with Down syndrome or any intellectual developmental disabilities. For all children, bruxism is a normal part of their development until they get their adult teeth. It's that feeling of where does the groove meet the tooth, for them to feel that comfort. And then for some children, it's, I like how this is feeling that the groove is not meeting the tooth. This is making me feel good. So there is not much we can do. We can work with the occupational therapist. We can take a look at the teeth and see if damage is being done. But the majority of times it is talking to your doctors to see if there's anything to relax the child. And I really hate that. I really hate going to medications. I would rather therapy or no treatment at all. One parent came in last week though with a necklace that was rubber links. And she bought that off of Amazon. I did tell her to leave the information with our office manager, so I see if I can find it. And he now has started placing that in his mouth instead of the grinding. And I thought that was a wonderful idea. Of course, make sure it's safe. One of these days, Michael and I are going to invent something like that that prevents cavities from forming too. It's going to be lace xylitol, something like
Double whammy, double win.
yes, yes,
That's
yeah,
brilliant.
yeah,
Somebody said, and I just want to mention and draw your attention, everyone, to the chat. Michael's putting some great links in for social stories and there was one for the toothbrush you talked about, Doctor.
okay.
So be sure to check out the links in the chat. But somebody said, my son refuses to brush. He's 6, lots of sensory issues in the mouth. I'm wondering, if this might be a good time to show the tools you sometimes use,
Yeah,
Michael, or yeah.
yeah, and yeah. I was going to add, Michael, as you're going to show those tools, brushing in the shower. Again, I don't know why no one's invented a shower head that, like, sort of like wash the hair, wash the teeth. So brushing in the shower, using a finger cloth brush. And I'm sure we have some other things, auto brushes, things like that as well too. But yeah, working with occupational therapists, brushing in the shower, he clamps his jaw down. I do have, we have that little mouth prop that I do give to parents. I'll have to look for that one as well too. It's a white foam. Have you parents seen that? A bite stick? It's a white foam. It's almost like you took popsicle sticks and wrapped gauze around it because you want it to be something soft and gentle so that you get in there. But today I introduced it to some patients here in Tucson for the first time, and they thought it was a microphone. So they're like, oh, microphone. And I said, oh, let's make that microphone a popsicle stick and just manage to get it in there so that I can get in and brush without them biting down too hard. So yeah. Oh, yep, exactly. Those sticks work great.
Michael, would you give?
Dion,
Yeah.
I'm just piggybacking on you and putting the links in there. So the bite block, the foam bite block I put in there, the sensory chew toy for the necklace. What we have here, we distribute out nationwide, is the Smile Kit, common dental instruments, a bib, mirror, gloves, prophy angle, a bib holder, floss, and the saliva ejector. Basically, common dental instruments that you can probably ask your provider, or we can actually do a volunteer kit and just send them off to Iron Will and Caring Tide, and you get a sense out to your communities as well. But gives a chance for you as a caregiver or your therapist to play doctor at home.
Yeah.
So put the mask on, and the prophy paste is not going to be fun, but it's a little paste. But it's get to get your loved one used to it. So if they touch the instrument, if they feel what the gloves feel like, and what a bib is, they'll be a little bit more prepared. So I'll work with Kathy and Carly, and we can put a volunteer project together so we can send quite a few out to their respective organizations and distribute them out to you all.
Amazing. And I need to speak to that kit because I got one in Texas, and Jed was so enamored by it and loved it because it feels like fun and play, and I want to try it out, and it's just brilliant. It's brilliant because so much of the fear is what you don't know. And as parents too, like we're afraid of what we don't know. Somebody asked, my son won't sit for x-rays. Any tips for that?
So again, I think practicing, I mean, and one piece of advice would be if you could ask the doctor to let him have a mirror so he can see what's occurring, that will be one idea. So practicing taking pictures, whether it be with your phone or whatsoever, they're going to take that picture of their tooth. But I hope if it's routine x-rays, I don't want you to fuss too much. We of course want x-rays. We're dentists, right? We want to see every single thing inside the tooth and every single tooth. If we absolutely need those x-rays, let's say, God forbid, it's a fractured tooth or something of the sort, in any case, we're going to sedation to do the repair. If that's the case, then we'll get the x-rays at that appointment. But patterning for routine x-rays is an awesome thing. I would not at the first appointment push for those x-rays, but I'll let them know the next time they come, we're going to try and get a picture. The way that I see it done at Pacific Dental Services, Pacific Dental Health Special Needs Clinic, is that they would first take a picture, an actual picture of the child, so photograph, and so they get into that idea, that vibe that, oh, they're taking a picture of my face and my teddy bear, and now my smile. Oh, and now they're putting this piece of paper for me to bite down on that's like a cookie, and doop, they took a picture of inside my tooth. So hopefully your provider is going through all the different steps to get to where it is the actual x-ray. And if you can practice that at home, maybe that might help. But please, I don't want you to worry too much. If we need an x-ray, we will get it. We'll get it.
That's brilliant. The progression of the picture. Jed
Yes.
loves getting his picture taken, so I'm sure he would cheese it up. That's brilliant.
Yes. Yeah.
Somebody asked, any tips on finding a dentist who specializes or has had this kind of training? Is there an additional certification?
So definitely pediatric dentists would have had training in caring for those with intellectual and developmental disabilities. Then also, if you look under the Special Care Dental Association, SCDA, there, and I'll try and get a link to that for you all. You can certainly reach out to Michael and the AADMD, to Michael and myself, and we will take a look and see who do we have in our network. So it depends on where you're at, but your safest bet would be a pediatric dentist or pediatric dental training program. And right now, every single dental school is mandated to teach dental students to care for those with intellectual and developmental disabilities. So if they don't have a program already existing for those with intellectual and developmental disabilities, they are hurrying up trying to find one. So they may be grateful for your phone call. So yes, a pediatric orthodontist someone's looking for? Yeah.
Oh, in Los Angeles.
Oh, I might have somebody.
Ha ha ha.
Can
And I was
I
while
can I
you're
afterwards? Okay.
if you have that I was going to say too, there's in most communities you can ask your friends in the disability community if there are good dentists for them, and that's what I did here, and we found someone who does all the things you've described, doctor. So sometimes that's a
Yes.
good way to find out too.
I have a connection in the Philippines. Okay. I think, Michael, what we're seeing here is we could be such a big help if we can help network get dentists to patients. Wow. I'm super excited. Um, Finding a craniofacial center at a children's hospital, they should have an orthodontist that's a pediatric orthodontist that cares for those with disabilities too. And I mean, I keep saying that over and over, but just cares for children and their teeth. Yes. So yeah, but from if we're able to help, that's what we really want to do. For the person that's from Oregon, I'm working with a family right now, I think in Bend, Oregon. Oh my goodness, it is such a struggle in some areas. There's so much help sometimes, and you don't know who's the right and best person to talk to. And I really believe in working with universities and organizations like Pacific Dental Services, but there are amazing private doctors out there. There really are. So take your time and do your search, and yeah, reach out to us for advice, or if we can give any recommendations, or even make that first phone call for you on your behalf. Okay, and see what we can do.
That's amazing. Those are all the questions that I wrote down. Does anyone have anything in our last few minutes here to pipe in?
Dr. Dion, maybe you can talk about the transition into adulthood as
Yes.
patients with disabilities and also Down syndrome, different things to think about, even ortho. I think some of the misconceptions is you have to break a jaw to be able to get some of the stuff done. So, Dr.
No,
Dion, maybe if you can shed a light on that and
sure.
maybe alleviate some worries.
Sure. With every appointment, do know that we're taking a look at your child from the minute they walk through that door and we're smiling and chatting with them. We're looking at symmetry of the face, right? So, and we're looking at your child now, but what are they going to look like 10 years from now? And do I need to start thinking about intervention? We're looking at the way the teeth come together. And even though with primary teeth or baby teeth, it's too early to think about braces. And my gosh, you're just trying to get to brush those teeth. We are looking to see if the teeth are aligned or if it's in crossbite, things like that. If there's an overjet, what is the overbite like? We're asking if there are any habits. We know that we're going to hear yes. And we're already thinking, okay, this is a child that's going to transition into a young adult, that's going to transition into an adult that's going to need some help with where those teeth are aligned and how they're aligned. Because the alignment alone, the crowding, can lead to food trapping and cavities. And so, even if they don't have cavities now, we're not just thinking about the now, we're thinking about how do we create a young adult and an adult that will have healthy teeth. And I don't want you to rule out uh, orthodontists for your children. Orthodontists are trained to take care of teeth, not that are crowded, rotated, or whatsoever. It doesn't matter the human being that comes in with it, as long as that human being, they can give them the love and care and attention, and they can sit comfortably in the chair. They can care for all children's teeth and have them aligned well. We want to make sure that we are training our dental students to not just care, not just have the pediatric dentist do all the work. These children will grow up to be adults and they need to have that comfort of care and nice healthy teeth as well too, which is why it's so important to talk to you at this stage. And if you can be the ambassadors for us and get the message out, the less we have to do when they're adults, the better. But that starts with early training now and intervention now, and working with the child now so they can grow up to be an adult that doesn't need a lot of dental work. And if they do, we are trained to do that as well. At our office, we're doing root canals, dentures, crowns, everything, where others are saying, no, you can't do that because that person has this, that, and the other. We're looking at what that child can do, what that teenager can do, what that adult can do, and giving them the dignity and quality of life that everybody else has. We'll probably get into the end, and I do want to share my story about Chris. Chris was a child patient who became a teenager patient, who became a young adult patient, but he really wanted to be in the dental field as well too. And this is a young man with Down syndrome, and we were able to have him go through the training to be the assistant to the dental assistant. And he really is our most fun person. This is in Buffalo, New York, but I know it will happen for us here too in Arizona. He's just the most fun person to be on our dental team. But most important, it gave him dignity of life. And parents that come in with their children with Down syndrome and see this young man working with me, they are just so warmed. They feel this comfort that my kid is going to be an adult who is a-okay. So if Chris can, I know your kids can as well too. And he now is an advocate for young adults with Down syndrome to keep their teeth healthy. If not, I'll see you in the office tomorrow evening, that type of way. But yeah, it's just a wonderful life, really, when you're taking care of somebody's smile. It really
Mm.
is.
What a beautiful story. I'm wondering, I know we have to wrap this up, but do you just have like a word of advice for the anxious parent going into the office with their child? Because I know that I probably can sometimes do more harm than good for my son when I walk into the office.
Yeah. Do know that we are busy training our dentists to be a practitioner of love. And when you find that right dentist, you will feel it. you're in the United States of America, you can search around to find that right person while we're busy trying to create them. But, you know, there are truly dentists out there who care about your child and your child's comfort. And I want to stress that yes, it is about anxiety and you know, all people have some sort of anxiety. And if we can just teach that, you know, we understand that. I think that is a word. Find someone who understands, you know. We've been through some tough times, even just going through dental school. We understand. Or you might find a dentist that has a person with an intellectual and developmental disability in their family. But what we're trying to do is train all dentists to have that level of care. To me, if you're interviewing for dental school and I don't detect that you have that, I'm not accepting you. All right. Dentistry, like I've said over and over again, is a profession of love. You have someone who is laying back in your arms and trusting you, far less bringing their child to you. So we're working on our end to make sure that that practitioner is seeing that you're anxious and is there to provide comfort of care, to comfort you, to comfort and console you. So do know they do exist. They really
You give us hope, Dr. Dian. Thank you.
do. You're welcome.
What a delight. This has been so informative. Thank you for your time, Michael and Dr. Dian. And yes, the biggest advice I got is slow is fast and small is big. Don't be discouraged if you start with 3 seconds and then 5 seconds and then more. That's right.
I
That's right.
love that.
Yes, so good. I hope we can do more of these. This was wonderful, and we'll stay connected. And thank you so much for your time, and thank you everyone for coming out. Truly,
Thank you.
been a
Take
delight.
care.
Bye bye, everyone.
Everyone.
Bye.